She now has lost over 100 kgs after having gastric sleeve operation. She couldn't be happier with a new lease on life. It is not, though, one of the cheapest options. Bernadette is facing a $90,000 bill for a new body. To tell us more, Bernadette Abboud and her surgeon, Dr. Barnouti. Good morning, both of you.
Good morning.
Bernadette, congratulations.
Thank you very much.
I know it's been a hard slog.
It has.
What was the moment you've gone, I have to change?
It was when I was waking up feeling like I've just lost my breath while I was sleeping and feeling my heart beat extra. And I just thought, that's it, I can't take it anymore. I need to do something about it.
Doctor, at 197 kilos, this was more of a life-saving operation rather than a cosmetic.
Absolutely. That's what people feel. You know, people, once they start losing weight, they find themselves, they have massive amount of skin and fat sagginess. And unfortunately, this phenomena goes throughout the body. So they have it in the tummy, in the breast, in the thighs, in the arms, in the neck. So it is really, they feel very uncomfortable about it. It's unhygienic, it is unhealthy, it causes a chronic infection and causes severe back pain. So it's really a saving procedure.
It started with the gastric sleeve, which basically, how does that work in your stomach?
Basically, they remove up to 70% of your stomach. So everyone has an elastic band around their tummy. They remove that so it doesn't allow your stomach to stretch. So amongst that, you also have a craving cell, and they remove the craving cell as well. So you don't ever crave anything once you've had the procedure.
How do they remove a craving cell?
Apparently, it's part of the elastic band around everyone's stomach. So I thought, well, if you're going to remove it, it's going to benefit me.
Okay, you physically can't eat as much food then,
That's right.
Is that right?
That's correct.
What happens if you do?
It will come straight back up. So it doesn't stay in my stomach for long if I do, but your stomach gives you that warning. It makes like a little sound, or you feel that bit of uncomfortable feeling. And I know that's when I need to stop.
So it's taken you 3 years to lose the weight, and I'm sure that was still very difficult for you to do. Did you actually have to employ some real personal willpower to do this?
Most definitely. That was one thing I needed to take into consideration.
What were the triggers in your mind to get you to the 197 kilos in the first place, and what's changed?
I think it's because back then I didn't pay attention to myself and I didn't have time for myself. It was always uni, work. So I forgot me. Now that my life is in control, I started to focus on me and thought, you know what, if I want to live longer, I need to do the right things.
Doctor, in terms of post-losing weight, okay, here we go, lost 100 kgs. Obviously there is excess skin, but this is basically a whole body lift. Can you just go through each of the procedures that Bernadette has gone through and will?
Yes, absolutely. People who lose massive weight, they go through actually 2 stages of procedure. The first stage involves reshaping and lifting the breast, tummy tuck and body lift. That's the first stage of the procedure, and this takes 7 to 8 hours. The second stage of the...
And that's in one operation?
That's in one operation. It's a very big operation. It takes 7 to 8 hours, and recovery will be long. Recovery will be about 2 to 3 weeks. The second stage of the operation, where we address other part of the body, and that is the thigh. So we'll do a thigh lift, arm reduction, and some people also require neck lift procedure. That's another 7 to 8 hours of procedure. So people who reach their target weight loss, they think they are at the end of their journey. It's actually the start of another plastic surgery journey.
Do you actually literally cut out that skin and seam it?
More or less, yes, that's putting it in a simple words. Yes, we remove the excess skin and the fatty tissue. We often tighten the muscle, especially when we do the tummy tuck, because the muscles tend to separate. And then we pull everything down, we remove the excess tissue, and we repair all the structures underneath.
Tough going under any surgery. I know it's been tough. You've got more to come. Is this what you've really wanted in your life?
The surgery part, no. I never expected it. All I expected was to lose the weight.
How happy are you?
So happy. I feel like I've got a new life ahead of me, so I'm looking forward to it.
That pair of jeans?
Yes.
From when?
From when I weighed about 160 kilos.
Wow. Just look. Oh, sorry. Tight dress. Oh. There you go. You happy to lose these out of your wardrobe?
Definitely.
Listen, congratulations.
Thank
Achievement
you very much.
is a very fulfilling experience, and well done.
Thank you.
And Doctor, thank you very much.
It's my pleasure.
Bernadette, And Dr. Barnouti, we really appreciate
Thank
your
you
time.
very much.
More
No
success to you.
Thank you.
More coming up at this. Could be interesting.